is your question? Sorry, I was fixing. I just realized there was error, spelling, sentence grammar or error. Okay, right. So if you have read and understood, considering its surgical anatomy station, kindly tell me if you can identify the region. On the left-hand side, if you can identify what point A is, please.
Ma'am, this is the anterior part of the thigh, the
Okay,
femoral
very good.
triangle.
Yes. All right. Maybe if you could say the upper third of the thigh
Okay. Yes,
or the
upper
upper
third of
half.
the thigh.
Yes. Yes. All right. Can you please tell me how this femoral region is formed, or what
Yes,
does it
so
constitute of? Yes.
okay. Superiorly, it is formed by the inguinal ligament, and laterally
Okay.
is
Can you
formed.
identify the inguinal ligament as we are talking? If you can tell me
Yes, ma'am.
which number is inguinal ligament.
Ma'am, it's number 11.
All right. Good.
Yes,
Okay.
and laterally it is formed by
11.
the sartorius,
Yes.
which
Yes.
is number 21, and
Yes.
medially it is formed by the adductor longus, which
Yes.
is number 2,
Okay.
and the floor is formed by the ilius vas, iliacus, ilius vas, pectineus, and also by the adductor longus.
Can you
And
please
the
tell
roof
me?
is
Yes.
formed by
Yes. Yes, please.
the roof is formed by the fascia lata and the superficial fascia, and also contains some superficial inguinal lymph nodes.
Okay, good. Thank you. Can you tell me what is inguinal ligament?
Inguinal ligament, this is the thickening and aponeurosis of the external oblique muscle
It is
that is
attached. Yes.
extending from the anterior superior iliac spine to the symphysis pubic, to the pubic tubercle.
Can you please tell me the contents of the femoral triangle?
Yes, from laterally, there is the femoral nerve, then the femoral artery, then femoral vein, and then it also contains the lateral cutaneous nerve, a femoral branch of the genitofemoral nerve, and great saphenous vein. And also there is deep inguinal lymph nodes.
No, you have to tell me what are the contents of femoral canal. Most medially is the femoral canal. So you have to say
Okay.
yes. So if you can tell
Okay.
me the boundaries of the femoral canal, please.
Okay, femoral canal superiorly is anteriorly from the inguinal ligament, posteriorly by the pectineal ligament, and medially is
Laterally,
formed
yes.
by the lacunar ligament, and laterally by the femoral vein.
Very good. Okay, what are the, now tell me the contents of the femoral canal, please.
Femoral canal, it has fat and some the lymph nodes, lymph node of Cloquet.
Okay, very good. Can you tell me one physiological and one pathological function of the femoral canal?
Femoral canal, it helps the femoral vein to expand.
Yes.
And
pathologically, there could be, since there is vacant space, so that it can lead to femoral hernia. All right. Can you tell me what you understand by the vascular lacuna and muscular lacuna, and what are their
Vascular,
contents?
yes, the vascular lacuna. The vascular lacuna. It is uh,
Behind and or below the inguinal ligament. It's medially, and what's the contents? Deep
it is behind the
inguinal.
inguinal ligament, and
Yes.
it consists of the deep inguinal lymph nodes, the femoral vein, femoral artery, and the femoral branch of the genitofemoral nerve.
Okay. And the
And
muscular lacuna.
the muscular lacuna, it lies laterally, and
Yes.
it consists of the femoral nerve, iliopsoas, and the lateral femoral cutaneous nerve.
Very good. Okay. Can you please tell me, in the right, if you can tell me, please, which muscle is, what is this? If you can identify this structure 19. Is it 19? Yes.
19, it is sartorius.
Yes. Can you please tell me the attachment of sartorius muscle, please?
Sartorius, it is inserted in the medial aspect of the tibia, along with gracilis and semitendinosus as the pes and
What is
seminus.
the nerve supply of this muscle, and what is the mode of action?
Sartorius, it is supplied by the um, femoral pus.
Okay.
Don't remember it.
Say, I'll come back to this question later. Okay. Can
Okay.
you identify this structure over here, please, on the right hand side? Number
Uh,
6.
just
This one.
number 6, it is the femoral artery.
Artery. Very good. Because 8 is
8 is the femoral vein.
vein. Very good. Because the color, and then, okay, if that
Yes.
is, then what would be 7 be?
7 is the femoral nerve.
Very good. And over here, if you can focus closely, what is 5?
5. This is profunda femoris.
This is 6.
Maybe
So you told me
this is
femoral
femoral.
artery. Which branch?
This is the profunda femoris.
Okay. Can you tell me, if you exercise here, sartorius muscle, what comes over
Yes.
here? What is another name of this triangle? And what are the boundaries of this triangle? How is it formed?
It's the adductor
Hunter,
triangle,
yes.
adductor canal, and laterally it
Also
is formed
called
by
as
the
Hunter triangle. Why
Hunter's
does it called
triangle.
Hunter's triangle? Can you tell me?
No.
Okay, you'll
Pass.
come back to that one later. Can you tell
Okay,
me the
I'll come back to
boundaries
it
and
later.
the contents, please? Do you know?
Yes, it is laterally formed by the
Yes,
vastus medialis,
yes.
and superficially by the sartorius, and posteriorly by the adductor longus and adductor magnus.
Contents, please, quickly.
And content, it consists of the saphenous nerve, superficial femoral artery, superficial femoral vein, and nerve to vastus medialis.
What is the purpose of this triangle? Okay, we'll come back
Through
to
this
this one.
triangle,
Yes.
uh, the femoral artery, it passes through this and goes into the posterior compartment of the thigh and forms the popliteal artery.
Okay, can you please identify structures given in picture on the left hand side and then on the right hand side, please?
Okay,
What
and
is A, please?
A is the femoral artery,
Popliteal,
and uh,
poplite,
um,
or the finger.
um,
What image is this?
it's an angiogram of
Okay,
angiogram,
of
yes,
which region? Low limb, simple,
of the lower limb,
lower limb.
angiogram of the
Yes,
lower limb. Yes.
angiogram of the lower limb. Okay, can you identify number 1 over here on the right hand side, please?
Uh,
It's the
yes, ma'am.
catheter.
This is the
It's the catheter. And then number 2
okay.
is You
is
know, the big, yes,
artery, the femoral artery.
yes. And then this
Then
femoral artery divides into what is 3 and 4?
the femoral artery divides into the superficial femoral and the profunda femoris artery.
Okay. If you can
So,
identify 7, 6, and 5.
Sorry, ma'am.
Okay, we'll come back to that later.
Okay.
So, okay, good. Thank you.